Trauma in its widest sense is a disease caused by physical injury to the body, and it's recognised as a disease by the World Health Organization because of its profound impact on the public health around the world, and because as an entity it has its own pathophysiology, its own causes, its own mechanisms and its own treatment. Surviving is a challenge for trauma patients from the minute that they get injured, whether they're hit by a car or fall out of a window or get injured by a knife. They're taken really to the limits of survival, and modern medicine can keep them alive most of the time and fix them up, but their body, their cells have all been taken right to the limit, and if they are to survive, those cells and organs need to be supported through it. If they survive, their challenges then are in actually recovering, being rebuilt in normal form or as close to function as possible, and then their challenge is getting on with their lives and getting back to some semblance of a normal life. Around the world, about 6 million people a year die due to injury, and it's on the rise dramatically. It's the only disease whose mortality continues to rise. Every other disease around the world has been appropriately targeted and managed, but injury, as people get more active, as people get older, as children have less protection in certain areas, injuries are just on the rise. And more than malaria, AIDS and some other infectious diseases all put together, it doesn't touch the sides when it comes to how many people are going to die due to injury. I went into trauma because when I was a junior doctor I saw a number of patients that I thought could either have been treated better, or really it was obvious that we really didn't know how to treat them and we didn't know what we were doing for them. I remember somebody who was injured in a bomb blast in Camden, who the team looking after him were really just so shocked and unsure of how to look after him that they were just almost frozen in action. And I was very junior and I myself didn't understand, but I could tell that something was wrong, and that essentially this was a population of people who were being potentially neglected by modern medicine. So we've had huge changes over the past decade, both in terms of how we manage patients, our understanding of the disease and therefore how we treat it, but also in terms of how we organise healthcare in order to make sure that patients who are injured get to the right hospital, the right specialists, the right resources at the right time. And so alongside those changes has come a dramatic improvement in survival. Research remains important though, because still if you're severely injured, there's about a 1 in 3 chance that you're going to die. And for everyone who dies, there's up to 4 people who are left severely disabled and severely dependent on their families or the state, and with a relatively poor quality of life. And a lot of those deaths could be prevented, and a lot of that disability could be ameliorated, and a lot of people who are left languishing essentially could be supported back into full-time work or education. And so there's still a lot of opportunity to do better for patients around the world in terms of the disease of trauma. The Centre for Trauma Sciences is a unique entity around the world, where a group of researchers have come together to really focus their attention on trauma and injury, and to really understand the mechanisms by which the disease exerts its effects on the body, and then to try and bring new treatments, new therapies online, and to understand how the injury and those treatments affects the outcome for patients. Just like with any disease, it is much better to prevent it than to cure it. And so we are as much concerned with trying to prevent injury from happening as we are from curing it. And that's a whole range of things, from avoiding cyclists being injured on the streets of London to reducing knife violence in this country, to improving pedestrian child fatalities in the third world. So we have a broad approach and are working with a number of partners to try and reduce the overall prevalence of the disease as well as how to cure it.